Hi everyone, I'm Shanae Miller and welcome to our presentation.
I'm Nicole Felix Tovar.
I'm Caitlin Plum.
I'm Ashna Jagtiani.
I'm Osama Hussein. Our intervention is RAMS, Racially Aware Mental Health Services. Within the United States, COVID-19 has caused a major strain on hospitals and healthcare workers. Healthcare workers, including nurses, doctors, techs, and environmental service workers, and everyone in between that keeps the hospital functioning, has experienced an increase in anxiety, depression, and post-traumatic stress. Frankly, healthcare workers are seeing the worst part of this pandemic, working day in and day out to save lives. The Black community. Black Americans are more likely to suffer severe COVID-19 and are 3 more times likely to die from the disease than white Americans. The year of 2020 consisted of regular reports of racism and violence contributing to a large amount of trauma within the Black community.
We will be targeting our intervention in Daughtry County because of how hard it has been hit by the pandemic. The Phoebe Putney Hospital System is the largest employer of healthcare workers in the region. Specifically, our intervention will focus on all healthcare workers in that county that are employed by the hospital system, with special attention being given to the needs of Black healthcare workers. Our goal is to address mental health challenges and improve mental health among healthcare workers in the time of COVID-19 in Daughtry County, with particular focus on racial sensitivity. Our project addresses both the immediate need for establishing support to healthcare professionals, as well as providing the means for accessible mental health services through a 6-month emergency period and a year-long pilot period. The social ecological model provides a framework for a successful intervention. We are addressing 4 levels of the model with our project as demonstrated in our slide. Our project begins immediately with community needs assessment. As the needs assessment is being completed, we begin our emergency period with community events, education, and developing partnerships. The 12-month pilot period then consists of the implementation of telemental health apps, more community events, and different classes. At the end of our 18-month period, we will then conduct robust evaluation of the program and publish a report.
Our initial 6-month emergency period aims to deal with the acute mental health distress of the community by assessing the challenges and treatment barriers faced by diverse healthcare workers in Daughtry County, by organizing events with community partners, promoting positive mental health behaviors, and increasing resilience. It's important for us in our project to involve the community, so starting on day 1, we will distribute a survey to gauge the community's needs to inform our intervention. We will then adjust our plan to better fit the needs of the community if necessary. We'll also partner with community organizations to put on both in-person and virtual events, making sure to meet all COVID guidelines. And stigma is a huge issue in mental health treatment overall, and it is especially notable in the Black community. Our education program will utilize both digital and physical infographics and pamphlets to enhance awareness on mental health issues, reduce the stigma, and help healthcare workers to feel and know that they are not alone. Our program, Hotspot checkout program, will purchase 200 hotspots to provide reliable internet access to increase access to virtual therapy sessions. Participants will be able to check out our hotspot kit for 3 weeks at a time through the Daughtry County Library System. And we will partner with library personnel to implement a sanitizing protocol for returning hotspots to minimize the risk of transmitting COVID. The aim of our 12-month pilot period is to offer access to telemental health platforms, improve awareness of mental health treatment options and tools for self-compassion, and to promote positive mental health behaviors through further education and community building. For the app, part of our project, we will provide free counseling to 1,000 participants for 6 months. We will hold yoga classes in the park across from the hospital to promote mental and physical well-being, and also use a partnership with the meditation app Headspace to offer a free subscription for participants.
BetterHelp is an app designed to make professional counseling accessible to those who need it. Solace is a new app designed by Black people utilizing Black therapists. It is meant to eliminate the need for code switching and the intimidation that many Black people face when seeking medical care. Our program will combine BetterHelp and Solace. BetterHelp is an established app while Solace is still up and coming. We will enlist the developers of Solace as consultants, using their input and knowledge on the Black experience to ensure that the BetterHelp platform is meeting the needs of the Black community. This will allow us to create the most effective and racially sensitive experience we can without excluding anyone. We will continue our education efforts from the emergency period into the pilot period. However, we will expand our materials to also bring awareness to various treatment methods. Yoga is a known method for treating mental health issues. The classes will be taught by 4 different local instructors on different days to provide accessibility to healthcare workers. Each class will cap at 25 people to enable distancing, and there will be a virtual option too. We will provide equipment such as mats to include COVID safety measures. Based on the results of our focus groups and surveys, we will continue the most beneficial events from the emergency period, still following all CDC guidelines. Training in mindful self-compassion led by a Georgia-based professional could help the healthcare workers combat burnout and self-coldness. Classes would go over scientific research, strategies, and dealing with difficult emotions, and could prove beneficial beyond the pandemic.
We will conduct a robust project evaluation, assessing uptake, implementation, and mental health outcomes. We will submit a report with our findings, which will be posted on our website and sent directly to our partners and stakeholders and collaborators. We will monitor our program through surveys and focus groups. We will have staff on site to facilitate smooth operation. The program will be evaluated through comparing and analyzing survey results and focus group responses from the beginning and at the end of the intervention. For our budget, a majority of the money is allocating to provide 6 months free BetterHelp to participants. Our next largest expense is personnel, and the third is the hotspots. We also have a category to be allocated for any extra costs we may encounter. Discounts, donations, and volunteer services from partners such as T-Mobile and BetterHelp account for $300,000 that we will not have to pay. Our main partners and stakeholders are, of course, Doherty County Health Department, Public Library, and Phoebe Putney Hospital System, as well as BetterHelp, Solace, and T-Mobile. We have many strengths and opportunities in our project. We emphasize on community involvement, making our project sustainable. We have the opportunity to promote local teachers and organizations to our events, scale the project to other counties, and create future partnerships. Education is inherently sustainable because it provides participants with tools to continue the project even after it has been completed. Our focus on education allows for a lasting effect. And that brings us to the end of our presentation. Thank you.